We conducted a study of more than 500 residents of aged care facilities across Australia, and we've involved the residents and their families in rating their quality of life. And what we did was compare more standard Australian care facilities to an alternative model of care where people are in smaller group homes, in clusters that have better access to outside and allocation of care staff and greater flexibility of routines. And what we found was that there was a better resident and family rated quality of life for people living in these alternative clustered models of care. And there was also a lower rate of hospitalisations and presentations to the emergency department. There was lower chance of receiving potentially inappropriate medications. And we also found that the residents and their families rated their quality of care as higher. I think it's really important that consumers are aware that there are alternative models of care out there so they can drive the demand for this, because there's certainly much more choice in availability of styles of care facilities in some countries overseas. Also, funding to care providers in Australia is very focused on the care needs of the residents, and whilst that's important, there is no incentive for providers to provide alternative models of care, and there's no funding provided based on outcomes for the residents. Often quality of care is measured with very clinical measures such as pressure ulcers and catheter use, but we think it's really important that the residents, the consumers, can actually rate the quality of care themselves. This consumer rated quality of care tool that we developed, called the CCI-6D, includes elements that consumers, residents and their family members told us were important in quality of care. And basically it has 6 questions that are really simple, that even people with mild cognitive impairment can complete themselves. So it assesses how much care time the staff can spend with the residents, how much independent access to outdoor areas there is, whether their own room and the shared spaces in the care facility makes them feel at home, and also how much access to meaningful activities there is.